$5 per member per month, which is minimal when you compare it to that 16.1% increase. So the spreadsheet that Alton passed around is titled St. Mary Parish School Board 2024 Group Health Plan Renewal. It breaks it down by coverage tiers and plans. And you see we have it among the active employees with the 2 plans, the retirees with the 2 commercial plans and the Medicare Advantage plan, and then the surviving spouse tiers. We have a lot of different coverage categories. So you'll see the current rates on the left side of the thick black line, and then it says estimated renewal, but I didn't adjust that column. I actually printed this in Alton's office before I stepped in here. This is the actual firm renewal, reflecting the 16.1% increase. So currently, the share for the premium from the employer is $863,000, and that is per month. With the rate increase, you're looking at if the school board were to absorb the entire 16.1% and not pass any of that cost on to the employees, that would change the employer monthly contribution to $972,000, and that increase would be $168,470 a month, or over $2 million a year of an increase to cover both the commercial plan and the Medicare Advantage plan increase.
That the Medicare Advantage plan was in good shape, that we wouldn't be looking at an increase this year.
We are in good shape, and I do have, you see the flyer with our logo on top. That's an illustration of the Medicare Advantage plan, and I probably shouldn't have lumped it all together in that one spreadsheet, because the Medicare Advantage plan has done well, is in a good position, and I think it's important to look at it in perspective. If you go back to 2019, when we first adopted the Medicare Advantage plan, the rate per member per month was $289, and that saved us, compared to what we were paying before when we had the Medicare retirees all on the same commercial plan as everyone else. That saved us over $800,000 that year by going to the Medicare Advantage plan. But the rate was $289, and it stayed the same for 2019 and 2020. Then in 2021, we actually negotiated a reduction of $29 per member per month. So it renewed that year at $260. The school board did experience a decrease. The school, I'm talking about from the school board's expense side of it. And so that $29 decrease was not passed on to the employees. That was retained by the group. So we didn't adjust their premiums. The school board retained the decrease. So, and that decrease was a savings of $243,000 for that year compared to the prior year. Then the next year is when we moved to Blue Cross, and that rate went from $260 to $222. So that was a $38 per member per month savings, which, again, St. Mary Parish School Board retained that savings. They didn't pass that savings on to the Medicare retirees, and that saved the school system $319,000 that year compared to the year before. That rate stayed the same this year, 2023. And so moving on to 2024, the adjustment of $5 is what they're requesting, which has an impact of $42,000 for the entire year. So in retrospect, you could see that we're still at $227 per member per month. That's still a very low rate. And since the school system has never passed the savings on to the members, it's something you have to consider whether you want to pass any of that $5 increase on to the participating members. And this is an increase, but the benefits are improving. You can see the notes here. There's some extra benefits built into that Medicare Advantage plan. For example, the dental benefit is going from $1,200 a year maximum to $2,000 maximum, and it's going from a basic plan to a comprehensive plan with a $0 out of pocket for the members. The built-in vision plan on that Medicare Advantage plan is going from $225 to $300 for glasses and contact benefits, and the hearing benefit is going from $500 to $1,100. And then finally, the over-the-counter benefit, because the Medicare Advantage plan participants are given a card, an extra benefit card that each quarter it's loaded with an amount that they can go and spend on over-the-counter medications, vitamins, a long list of things they can purchase. And that just for that over-the-counter benefit is going from $50 a quarter to $100 a quarter. So they are seeing an improvement in their benefits. So one of the things the board has to consider on the Medicare Advantage plan is whether to absorb that $42,000 annual cost or pass it on to the members.
Years increases again, so I can write them down. That the board did not.
You have it. It's on on that flyer. It has our logo on the top.
That's why I couldn't follow.
Yeah, I have it all
It's
illustrated.
very little, James. My magnifying glass can't see it.
Oh, I think you have the wrong. Yes, that's the correct one.
Oh, okay. Thanks.
That's generally age 65 and over. There are some participants who qualify for Medicare due to disability, so there are some younger, but in general 65 and over. And it does include, because Blue Cross opened up that eligibility to active employees and their spouses who are 65 and over and have both parts A and B of Medicare. And we have had a number of them that enrolled in that Medicare Advantage plan. They save a lot of money doing that. And it helps the plan. It helps your main commercial plan, because generally the age 65 and over represent a larger portion of claimants. So that's one thing the board has to consider. Going back to the commercial plan, 16.1% increase. That overall impact just for that, just for the commercial plan is right under $2 million once you separate it from the MAP. And your plan is currently fully insured. It has always been fully insured, or at least as long as I've been your benefits agent, which is about 12 years now. And I think historically, the years prior to that, it was all the school board always maintained a fully insured program. Fully insured plan basically means that the insurance carrier assumes all of the risk. So in a year like what we're experiencing now, the insurance carrier, regardless of how high those claims go, they can't request more money from you this plan year. If you're paying in $11 million in premiums and claims hit $20 million, it's on the insurance carrier. They're taking the financial risk. Of course, just like we're seeing now, when they calculate your renewal for the next year, they're going to recapture some of that loss. And that's part of what's involved now, when they're projecting your 16.1% increase. Now, if we get a stop loss quote, and that's the one of the challenges when you're considering going from a fully insured plan to a self-funded plan. Timing is everything. Right now, we're not getting stop loss quotes, and your stop loss quote, when you say self-funded, many people think, okay, well, we're completely on our own. We're completely paying all of the claims, taking full financial risk on our group health plan. That's not the case. It's technically a partially self-funded plan because you would not want to go that route. I mean, you're a large group, but you're not you're a 1,200 participant group, not a 120,000 participant group. So it would not be a wise thing to go fully self-funded. So you're partially self-funded, which means you carry a degree of stop loss protection. And when you start out your first year, you're going to want to have stop loss for specific claims. That's for individual claims that exceed, like once it exceeds a certain point, whether it be 200,000 or 225,000, once it exceeds that point, you're no longer on the hook having to pay those claims out of your reserves. Your stop loss reinsurance kicks in and starts picking up those costs. Then you also want to, at least initially, carry what's called aggregate stop loss, which means on a group basis, if you have a whole bunch of those large individual claims, and just in a benefit year, you exceed a certain point, and it's based on, they calculate your expected claims, which for this group is about $12 million. And then they add what's called a corridor, 25% corridor. So 25% above that $12 million is going to be an extra $3 million. So you after $15 million of claims for the entire group in a plan year, the stop loss will reimburse you for the amount in excess of that. So if you have and you've never had a year that bad, but if you do have a year where you exceed $15 million and you're partially self-funded, that aggregate stop loss would reimburse the group for any amount in excess of that. So you are taking a greater financial risk, but you do have some built-in protections. Also, with this fully insured plan that you currently have, we can negotiate to a degree with the insurance carrier, and we have in the past. Over the past 12 years, we've slugged it out with the underwriters, and we've threatened them, and sometimes it worked, and they backed off of the rate increase. Other times, our threats included, "Hey, we'll move the group. We got a competitive alternative." And there were some cases where they didn't respond, so we up and move the group. We move the group from Blue Cross to United Healthcare, and then several years later from United Healthcare back to Blue Cross. That and mitigating rate increases by adjusting benefits are really the only things you can do with only responses to a fully insured program, because the carrier is going to dictate these are your rates. This is your rate increase. Take it or leave it. And sometimes they'll negotiate. Sometimes you got to leave them, but you're stuck, in the same situation with the next carrier. And we're at a point now with our benefit structure that I do not recommend mitigating the increase by further eroding benefits. We at some point need to position ourselves to start moving in the other direction, to start making incremental improvements to benefits. Because if you're trying to attract talented, qualified, young teachers, one of the things they're looking at in addition to pay is they're looking at benefits. And when they're going to compare St. Mary Parish School Board's benefits to St. Martinville, to Vermilion, to all the other surrounding parishes, you at least want to be in the running. You want to have a chance. So we're at a point now with benefits. I do not recommend that we erode those benefits anymore. We try to position ourselves to do just the opposite. So, and with a fully insured plan, you're limited. The carriers offer you a package. They say, okay, if you want a $2,000 deductible, it comes with this copay, this co-insurance. Your out-of-pocket is pretty locked in because it's all based on the Affordable Care Act. But all the other pieces of your benefits come prepackaged pretty much with fully insured plans. Self-funded, you have more options. You can pick what deductible you want, combined with what copay you want. And if you want to have a different copay for specialists than primary care, and you can have a different copay for urgent care, emergency room. You can customize your plan. You have a lot more options. And you have more say when it comes time for renewal. When it's renewal time, the insurance carrier is not going to dictate what your premium should be. The insurance carrier is going to, they're going to your renewal is going to be your stop loss. So your specific stop loss, and you're looking at, like we're working on Iberia right now, their specific stop loss and monthly premium is somewhere in the area of $65,000. We were able to negotiate that. We went out, we got other stop loss quotes, and that's going to stay the same. When we started the plan, the self-funded plan, we negotiated a 3-year guarantee period on the administrative charges. So that's what you get from the insurance carrier. They tell you, okay, here's what your administrative fees are going to be for next year. Here's what your stop loss premium is for both specific and aggregate. And then here's your prescription drug contract with all the built-in fees and the rebate structure. So those are the different components you consider. And so it becomes a very small piece of the premium. The larger piece of the premium is what you set aside in reserves to cover the claims. And you want to make sure you set aside enough in reserves to cover worst case scenarios. Like, what if you blow your aggregate? Okay, you want to have that money available to cover it. So you gain more control when you're self-funded in determining your rate increase, and you're not a 16% rate increase is not thrust upon you. Now there may be periods where your claims are so bad and you haven't done what you needed in the past to incrementally increase those rates, because there's going to be some times where I present you with your rate increase and everything's going to look great, but I'm going to recommend an incremental adjustment. I might recommend a 4% for next year. And the board, it's up to the board to say, well, no, we're not going to increase premiums on this self-funded plan. And that's a decision the board will have. You'll have that power. It just means less will go into your reserves. So there are benefits to self-funded. We don't yet know if it's going to be an option for this board for 2024 because we have not received any stop loss quotes, and we won't receive them until probably November, early part of November. So what the board is going to be deciding on, hopefully tonight, is whether to move forward or what to do about this commercial plan renewal. Because these rates, this new premium outlay with the 16.1% increase, that's going to be the rates we use, whether you stay fully insured or whether you move to self-funded. We're going to apply that same rate structure. So you can, in effect, and it's what I'm going to ask the board, make that decision tonight on the premium, on funding the premium. And then we're going to revisit, even though it's going to be in the middle of open enrollment, because benefits aren't going to change that first year. If you decide, if that is an option, self-funded is an option, and you decide to move to a self-funded plan, we're going to do so without changing benefits. We're going to leave benefits as they are.
Can I ask a question, please? On the stop loss insurance, you said it won't be in effect until November,
No, we won't get the quote.
the quote until
Right.
November. So we
Right.
still be able to get that if we vote on this tonight?
Well, what you'll be voting on tonight is the rate adjustment, like the new amount that St. Mary Parish School Board will be paying in their share of the premiums. Okay? The amount that the employees will be paying, like if the school board does, and I'm hoping the school board is in a position where they can absorb that increase to where the employees don't pay any additional. So if that's the end result of tonight's vote, then come November, when we get all the stop loss quotes and the admin quotes and I package up a stop loss proposal, a partially self-funded proposal for the board's going to be deciding, okay, our premium won't change, our benefits won't change. We're just going to move our funding mechanism from a fully insured plan to a self-funded plan. The employees won't see a difference in benefits. They won't see a difference in rates. They will be issued a new card, a new ID card if the board decides to go that route. And the new ID card will be issued to them. Other than that, it's a fairly seamless transition. It's not an ideal position to be in when you're making that change from fully insured to self-funded, but we're in that predicament this year because of the severity of our claims.
So with the self-funded claim, there's a better savings in this proposal also at the end, like you were speaking of earlier?
We can, in a moment, we'll move on to the projections that I provided, and that's in this little packet here. And I'll show you what's different about the self-funded plan, how it operates differently from a fully insured plan.
Okay.
And the best way to do it is to do some hypotheticals. So
you was talking about the $5 increase if we would vote on it. That's
the Medicare Advantage plan, right?
Okay.
That's not part of the self-funded. That's not part of the commercial plan. That's
Okay.
That's always going to be a fully insured plan specific for the Medicare retirees.
Okay.
But I'm assuming that would be a separate vote. So tonight it would be a vote on whether to accept that 16.1% increase and whether the board's going to absorb it. And that increase would apply whether those new rates would apply whether you stay fully insured or whether you move to self-funded. And again, the self-funded proposal, if we get some stop loss quotes, it won't be until November. And again, typically, like if we would have had a great year, then we would have received stop loss quotes along with our fully insured quote. Would have been ready to make that decision tonight. But as it stands, they want to see claims through October because the months have, the claims have been so bad. They want to see more claims before they release any quotes. There's a possibility we may get one quote, we may get no quotes, but we're hoping to get quotes from 5 different stop loss carriers. So just to give you an idea, you have this packet here, some projections for partially self-funded. That first page, that's a hypothetical. This is what I've been including on my monthly report at the bottom section. And I've been doing it since January of 2022. So this first page, the first 2 pages illustrate what I'll refer to as a minimum funded. That means you don't advance that $3 million to cover that aggregate corridor that I'm recommending. If you move to partially self-funded, I'm recommending you take $3 million, which represents an aggregate corridor, and you move it into the reserve fund to start out with the hopes that in 5 years, the board gets it reimbursed back to them. So, but this isn't not including that. This is if the board decided not to go that route. So, looking at going back, and this is applying actual premiums that we paid and claims that we paid. And I used specific premiums and aggregate specific stop loss and aggregate stop loss and admin fees that we received quotes on back then. Those were the actual quotes. And so if you would have moved to a self-funded plan January 1 of 2022, you would have ended the year with almost $1.4 million in reserves. Might sound like a lot of money, but on a group health plan like this, it's not. But it's better than having a negative. So, but you've accumulated nearly $1.4 million in reserves. So you start the next year, we would have started 2023 with nearly $1.4 million in reserves. And through the end of August, that nearly $1.4 million in reserves would have declined to just over 1.1 million. So far this year, we would see a decline in reserves. And all the red surplus numbers there, those are months where we experienced the declines, claims are so bad, we had to pull from the reserves. Now you look at February, $1.1 million came from the reserves. That was because of a very large claim. But you'll see in April, where it has a SL recovery, that's stop loss recovery. We recovered over $1 million of that, went back into the reserves. That's how a self-funded plan works. So that's where we would stand today, were we to have moved to a self-funded plan January 1 of 2022, based on actual premiums and claims. Next is the third page is going forward, projecting forward. If we were to move to a self-funded plan January 1 of 2024 and right here I have 15% increase. That's because that's what I was expecting, but we got 16.1%, but this is just illustrative. So yeah, the fonts are real small on here, so I have to put on my glasses. So you'll see all the different components. We have our combined contributions, the specific stop loss premium, which I kind of inflated thinking that it's going to be you know, we won't get the best, quote if we do get quotes. So I'm figuring 82,000 a month, aggregate premium about 8,000 a month, admin fees about 60,000. And then I estimated what the claims would be month by month. An important component, if you see that RX credit / rebate, in order for us to have any chance of a self-funded plan to work, we have to negotiate a very strong contract with the PBM to capture all or the majority of those rebates. Right now, they're getting it on a fully insured plan, but all that goes to the insurance carrier. So in a self-funded plan, you can negotiate it to where that money comes to the school system. And that's what makes it, without that, we're in the same position we are as a fully insured plan. So the RX rebates, that's a benefit to us. That's money that comes back to us. So you don't receive it the first 3 months that you're fully insured. After about 3 months, it starts building up. So you can see in this hypothetical projection for 2024, and this is with no advancement of $3 million. We would end the year about $926,000 in reserves. So if the board, let's say, they chose, looking at the financial position and the stop loss quotes, and we negotiate some guarantees on administrative charges. So the board says, okay, for 2025, we're not going to increase premiums, 0% rate increase. Then illustrating through 2025, with some adjustments, some tweaking with to claims. Let's say it ends up being a bad year, and we see a decline, a $24,000 decline in our reserves. We'd end the year with 902,000. And the board, let's say the board decides, well, we're going to, because of this past year, we're going to impose a 3% rate increase. And that's what the 2026 projection includes. So you see, you know, as you make those slight adjustments, even though claims increase, you still end the year out with almost $1.5 million in reserves. And again, this is just all hypothetical. I just want the board to understand how a self-funded plan functions. Then the next few pages it's the same thing, except I include that $3 million of advance funding for the aggregate corridor. And it just makes the numbers larger, $3 million larger. I know that's a lot of information, so I would like to open up to any questions that anyone might have.
Percentage of large claims, or the majority of large claims, are they children or are they adults? Or do we have that breakdown?
For this year, when you're looking at dollar spend, it's an unusual year because nearly, I think it's $1.4 million was spent on an infant. So that kind of skews the numbers. Normally 80% of the claims go to 15% of the population, which is that population of insureds over the age of 55. And not necessarily the retirees, it's just actives and retirees.
And are there measures in place to ensure that we're utilizing Medicaid and other programs to ensure that we're not absorbing the costs of our insurance policies?
We don't actively do the Medicaid, qualification part of it. I would assume that if you had workers who are making under that, federal wage guideline, there's a certain percentage of the poverty level that determines whether a person is eligible for Medicaid. People generally know when they're eligible for that, so they seek it out. So I'm sure there are, a group of employees. In fact, I know there's a group of employees that don't enroll in our plan because they're eligible for Medicaid. What's, as important is if and when the board decides to move to a self-funded plan, is to make sure, and we send out letters to, anytime we know somebody's turning age 65, we send them a letter and we send them information on the Medicare Advantage plan. Because getting them off of your self-funded plan when they're 65 and eligible for Medicare, and getting them on that Medicare Advantage plan, can have a huge impact. No, you can't make it mandatory for active employees. You just try to attractively, price it, which it is, when you compare it to the main plan and including the benefits, it is an attractively priced plan. But those who don't do it, or those who, let's say, might be on Plan B, or they may have a spouse on their plan, and then when Medicare premiums went up, Medicare Part B premiums increased. So when you have somebody, because as long as you're covered by a employer provided group health plan, you can defer opting for Part B of Medicare without being penalized. So, you have people on the plan now that are over 65. They didn't elect, they're not paying that $170 a month for Part B of Medicare because they're on the plan. When they're considering the Medicare Advantage plan as an option, that means they have to purchase Medicare Part B. And so when they add that 170 to the premium for the Medicare Advantage plans, sometimes they don't see it as a benefit to make that change. That's why it's important not to increase those Medicare Advantage plan premiums. If anything, if there's an opportunity down the road, if we do get reductions in the bill premium, it may benefit the board, especially when you're self-funded. If you do move to self-funded, you got to give serious consideration, and it's strategic of, okay, here's what the premium is for someone on the Medicare Advantage plan. And right now, if you're employee only, I think it's $90. Okay. So if you move to self-funded, you might want to say, well, what if we paid additional employer contributions and reduced that cost to $60? So as if an employee, combined that in addition to the 170 they're paying for Medicare Part B, it's $230. Right now, the premium for Plan A is $210, but the benefits are a lot better on Medicare. There's no out-of-pocket on the Medicare Advantage plan. So you have to be more strategic about that if you want to incentivize. But first, before you do all that, you have to really examine, okay, how many active employees and spouses do we have on our plan? If it's enough, and if they're contributing too heavily to the claims costs, it may be worth it to do that, to take that approach, try to get them, incentivize them to get off of the self-funded plan and onto the Medicare Advantage plan.
Madam President, I'd like to know, are we going to vote on this in this meeting tonight, this afternoon?
Tonight, we have to vote on whether or not we are going to absorb the $2 million increase. Correct? 42. We are.
Okay,
So the difference between the self-funded and the fully coverage plan essentially is, one, we're gonna be figuring out the $2 million, and then on the self-funded one, 3 million. Is that like pretty much in a general term? Right. Can you reserve the less than the 3 million? Like, could you go halfway in between? Okay.
Mr. Perez, I have a question. Can I ask a question, please?
First, Mr. Murphy had a question that we would get a recommendation from Mr. Perry.
Well, we're not voting now, it'll be at the regular meeting.
Right.
But my recommendation would be to just the funding level, except that we're going to cover the 16.1 and the 5% or whatever for the for both plans. And because I included that in the budget, we had talked and we had an idea. So that would be what my recommendation is. And that's all we have to decide tonight is if we're going to, how much we're going to pick. Will we pick up half or all of it or whatever? And then what James is saying, is regardless of that, then we can decide in November whether we're going to go self-funded or fully funded. So I'm going to my recommendation is that we absorb the increase for both of them.
Ms. Jones.
Yes, on our premium from last year, we have any saving that go forward for this year, since we're talking about the premium and everything? Did we have any kind of saving from fully insured to self-insured, any kind of saving left over? For 22 to 23, whatever year we going into now? Right. That's what I want to know. Okay, that's what I was.
So is there, okay, there's no better way for me to put it. Is the juice really worth the squeeze? In like a 10-year look at some schools that were comparable to our size and who's being insured, was there enough savings versus the risk of being fully insured, in your opinion? And when it's not managed responsibly, how did that work out for them?
I'm not gonna name the school.
Okay.
Local school.
but it takes discipline. And, right now, Tom's are fairly good with our budget, but let's just say we had a $6 million deficit, which we've had before. And we need a $2 million, need to put $2 million into the plan. I've seen boards choose to not do that because, defer that and use it for the deficit. And that's where it takes discipline.
Oh, I trust your discipline. I absolutely do. But at some points you've stated, well, we're coming to the, you know,
Well, the thing is, I'm not the boss either, but,
Right.
yeah, I would always try, as long as I'm here, to try to recommend the right thing. But it does get hard when you're facing a huge deficit, and you might be facing cutting employees' pay. So, when you get in such a situation, then there is a tendency to maybe underfund your self-funded plan and say, well, we'll make it up next year.
I mean, do you feel like this would be more of an asset or a liability, in your opinion?
Well, I'll feel better in November when we can see the stop loss proposals. I think what James said, if I understood correctly, is the real reason to do this is your savings you get on a prescription drug rebates, which we don't get right now, Blue Cross gets. And there's some of the flexibility. But the vote tonight's just going to be, are we going to, or is St. Mary Parish School, we're going to accept the whole increase or split it with the employees or whatever? And I think our recommendation for the health of the plan is to absorb the whole increase. As we start doing that, and then we may have younger, healthier people leaving the plan, which is not good.
Do districts that move into partially self-funded have to employ additional employees to manage?
Now, from the employee standpoint, they're gonna have a new Blue Cross card, but it's all the same for them. They go in, they're not even gonna see a difference whether it's self-funded or fully funded. Same network, same, everything.
Thank you, Dr. Perry. Private joke.
I know, I know.
Sal.
I thought you just said that we were gonna vote on the, whether or not we were gonna pick up the cost at this meeting. No, it's the next meeting. Okay.
Any other questions?
Vote on having this insurance without the stop loss, like you said, it's not gonna be active till November. This won't affect this policy for our employees.
I turned it off again or it went off? So that 16.1% increase will apply whether we stay fully insured, and fully insured doesn't involve any stop loss, okay? Or whether we decide in November to move to a self-funded plan. And that involves a stop loss. And that's what I'm waiting on. I'm waiting to see if I actually do get any quotes from the stop loss carriers in order to craft a self-funded proposal.
Anyone else?
Thank you, Mr. Perez.
Yes, thank you. I guess this workshop is adjourned.
All right. Thank you all very much.
Thank you.
Okay. I'm feeling great right now.
So now we got another.